Welcome, everyone. We're really pleased to have you here today for an IPUMS webinar on introducing IPUMS DHS to IHGIS geographic linkages. My name is Kari Williams. I'm the User Engagement Manager for IPUMS, and I'm really delighted to introduce you to two of my colleagues who will be presenting today's webinar. Tracy Kugler is the Principal Research Scientist at the Institute for Social Research and Data Innovation. Tracy received her PhD in Geography from Oregon State University, and she's been at IPUMS for over 14 years. Currently, she serves as the PI for the IPUMS IHGIS data collection. Sue Zhu is a data analyst for the IPUMS International Historical Geographic Information System, or IHGIS. Sue received her master's in quantitative methods in the social sciences from the CUNY Graduate Center and Demography Certificate from the CUNY Institute for Demographic Research. She currently works as a data analyst for IPUMS spatial projects like IHGIS and NHGIS, assisting in the dissemination of standardized census data tables and geographic crosswalks. Before I turn it over to Tracy and Sue, I'm going to talk with you all briefly about some Zoom logistics, and then we'll go ahead and get started. Next slide, thank you. So this webinar is being recorded. It will be posted in a week or two here. There are real-time closed captions that are being auto-generated. So you can turn those on or off by clicking a button with CC in Zoom controls. Usually those are in the bottom of your panel, though if you have a different default setting, they may be someplace else. If you have questions about Zoom specifically, send those as a chat to the host. That's me. I'll help take care of those. But if you have content-related questions, please use the webinar Q&A tool. We'll have some dedicated time for Q&A at the end of the webinar, but it really helps us keep track of those when you use the Q&A tool instead of the chat. And then we'll also use those to post a written Q&A document following the webinar. That helps the folks who weren't here today see what some of that discussion looked like in an easier to parse format. With that, thank you all for being here, and thank you to our presenters. I'll turn it over to them.
All right, thanks, Kari. So for the rest of our time, I will give a brief overview of the two data collections that we're talking about linking today, IPUMS DHS and IHGIS, and a kind of high-level overview of how the linkages work. Then I'll hand it over to Sue, who will walk us through a research example of the kind of question that you might investigate using these linkages. And Sue will also go into some more of the details kind of under the hood of how we do the linkages. And we will have time at the end for Q&A. Okay, so before we start talking about linking, let's talk about each of these data collections just to give you an overview in case you're not familiar with one or the other. IPUMS Global Health is the broader collection that includes IPUMS DHS. It also includes PMA and mixed data. All of that data is microdata, individual person-level records with some other record types from the surveys. The geography in IPUMS Global Health is GPS points, and we'll talk about those quite a bit later. So those represent kind of roughly the area where the respondents live. IHGIS is census data, so that's full enumerations of each country, and those are summary data. Generally, you get a table with each row being a geographic unit. We also provide GIS shapefiles that give you the boundaries that define those units that you see in the tables. And we get down to quite fine geographic detail in many countries. Next slide now. Okay, a little bit more background on the DHS program itself. IPUMS does not collect primary data. We use secondary data, and our main goal is to make these data easier to work with. DHS is one of the partner organizations that we work with, and we get the data that we then disseminate in IPUMS format. DHS itself has been conducting surveys since about the 1980s, and they work directly with the countries where they're fielding the surveys. There are the focus of DHS is on health data, primarily women's and children's health, working in low and middle income countries. And the DHS program has conducted over 400 surveys in more than 90 countries. We don't have all of that data in IPUMS DHS, but we're getting close. Next slide. IPUMS DHS is kind of another layer on top of the DHS data with some value-added features that make that data easier to use. You can access IPUMS DHS by going to ipums.org and navigating to the Global Health and the DHS page. That will get you to our data access system where you can browse the samples that we have and all of the variables within those samples, select the ones that you're interested in, and you get a customized download with just the samples and variables that you're interested in and all of the metadata you need to understand them. We harmonize variables across the different samples. That's a key feature of IPUMS. And we'll talk about that a little bit more detail, but the general idea is that you can compare variables across censuses from different places, or surveys from different places and different times, much more easily than you could with the original data. We also provide additional features like file linkages across different record types. We provide some contextual variables directly through DHS that we've calculated, and we do a fair amount with reproductive calendar data to make that easier to work with. Next slide. This is an example of the variable harmonization that I mentioned. Here we're looking at 3 different surveys from Burkina Faso, Kenya, and India. And we're looking at a variable about educational attainment. You can see in the column for each of those 3 surveys, they have slightly different categories for possible responses, depending on differences in that country's educational system. So for example, Burkina Faso, you might have no education, primary, secondary first cycle, secondary second cycle, and tertiary. The far left column is the integrated variable that you can access through IPUMS DHS. That has kind of 2 levels. We have a general level, which is consistent across all of the surveys. So that has these broad categories: primary, post-primary, vocational, secondary, tertiary, or higher. And those are indicated in the first number of the variable codes. And then the detail level, so you see under secondary, we break that down so that we can continue to preserve the detail that's in different surveys. So we still have that cycle 1, cycle 2 from Burkina Faso. We have the secondary A level from Kenya. There's more that you don't see on this example. So you can look across all of the different samples and see who has completed secondary education, or you can look at sample-specific information. Next slide. DHS has now nearly 350 samples over 84 countries. We just added a whole lot of those samples. So the samples that we have in Sub-Saharan Africa and Asia that we've had for quite a while, those will be richer in topical detail, and new countries that we've added recently, primarily in Latin America, some other areas of Asia and Africa, a few countries in Europe, those will have focusing on the variables that are common across surveys for the women, child, and birth records. Some of the surveys that we've had longer will have additional record types, household members, men, and the reproductive calendar data in woman months. And we'll be adding additional data to these newer samples in future releases. Next slide. Since we're talking about the linkages today, it's important to have an idea about the geography because that's how we do the linkages between DHS and IHGIS. In DHS, the geography is recorded as cluster points. Each cluster point represents kind of the centroid of a village or a neighborhood in an urban area. There will be multiple households associated with that cluster point. And those cluster points are displaced by the DHS program to protect the confidentiality of the survey respondents. So in rural areas, the cluster point that you get with the survey data can be up to 5 kilometers from where the actual on the ground centroid of that area is. In urban areas, it's up to 2 kilometers. And you do need special authorization or additional authorization to get access to those cluster points. Next slide. Jumping into IHGIS now. This is the contextual data that we'll be talking about that you can link to your DHS survey records. IHGIS provides census data from population and housing and agricultural censuses from countries around the world. The data are sourced from previously published tables in census reports or other data files that the statistical offices have made available. And we also provide the GIS boundary files that give you the outlines of the areas that are described in the tables. Next slide. Again, thinking about the geography as it relates to the linkages, IHGIS provides very fine geographic detail in many countries. Here we're looking at an example for the Dominican Republic, where the black outlines are the regions, so that's sort of the first administrative level. The green outlines are the finest geographic detail we have available for municipal districts. You can see we have 11 regions and almost 400 municipal districts. So those are much smaller areas and help you really get at the context in the local places where the survey respondents would live. Next slide. IHGIS has currently released data from published censuses in 45 different countries. For many of those countries, we have multiple years of data, or we have both the population and the agricultural censuses. So we have about 60 census data sets in total. We also provide data sets that are tabulated from the IPUMS International Census microdata. That's for another 300 plus data sets. And for those, we have a standard set of tables that we generate based on those microdata samples. Those are based on sample data sets, so they might not align exactly with what you might see in published results for those countries, but they should be close. The map here shows countries in light blue are those where we have the tabulated from microdata tables. The countries that are in purple, we have published population census tables. Countries in green, we have published agricultural census tables. And countries in the darker blue, we have both population and agricultural census data. So you can get an idea of the coverage here. Next slide. I'm going to give you just a brief overview of how the linkages are, or how they're represented in the data that you'll be seeing, and then Sue will give you more detail later. As I've mentioned, the way that geography is annotated in the DHS samples is with cluster points. Each of those cluster points is kind of at the center of where a number of surveyed households live. So here we're just showing a couple of different households that would be associated with this central cluster point represented by the blue crosshatched circle. Then the DHS program takes those cluster points and displaces them slightly. That's what's represented by this circle around each of those blue points. So those are either 5 kilometer radius or 2 kilometer radius circles. Those represent all the possible places where that cluster point could actually be on the ground, given the location that we have of the displaced cluster point in the DHS data. To do the linkages, we determine which IHGIS unit, represented by the colored shapes on this diagram, each of those cluster points falls within. And then we also provide information about how certain we are that that point is in fact in that unit, given these displacement buffers, these areas around each of those points where the on the ground location may have actually been. So if those buffers cross more than one unit, then we aren't entirely sure that the point is in the unit where we've placed it. Next slide. What that looks like with some real data. This is an example in Myanmar. The blue cluster points are in rural areas. The red cluster points are in urban areas. You can see, and then the lines are the boundaries of the units in the census that we have in the IHGIS data. You can see the urban cluster points tend to be in kind of smaller units because often census units in urban areas tend to be smaller. And then the rural cluster points are often in these larger census units. And then the buffers around those bigger circles represent the displacement buffers. And you can see that those sometimes are entirely within one census unit, sometimes cross the borders of multiple units. Next slide. Now let's look at what you would see when you actually download the data and go to make the linkages. This first part here is what you would get from IPUMS DHS. So these are your DHS census records for each individual person. You have the DHS ID is the ID of the cluster point that that person is associated with. The next two columns are the linking variables that you can get from IPUMS DHS, and those provide the codes of the census unit and an indication of the probability that that cluster point is actually in the identified unit. And then you would have whatever individual level variables you selected to include in your extract. Here we have age. And then next bit, this is an IHGIS data table example. Here we're looking at the total number of households that experienced food shortage. And we have every IHGIS data table will have this same basic structure. Each row will be a geographic unit. You'll have the names of those geographic units with their parent units going up the hierarchy, and then you have a GIS join code that uniquely identifies that unit. Next, click. Those GIS join codes match the codes that you get in the linking variables from IPUMS DHS. So you see UG104, that is the same code that that first cluster ID is located in. Next bit. Those linkages then allow you to attach the data from IHGIS to the data from DHS. So for now, for each individual, you have information about the households that experience food shortage in the district that that person's cluster point is located in. Next click. Because these are contextual data, you'll notice that multiple individuals can have the same contextual values. That happens for a couple different reasons. The first is you might have different individuals who are associated with the same cluster point. So here you have a 33-year-old person and a 37-year-old person, both associated with cluster point 25. They will have the same contextual value. Next click. You might also have multiple cluster points that are located in the same census unit. So here, cluster points 25, 26, and 27 are all located within census unit that has the code UG110. And those will all have the same contextual values. Next slide. We currently have these linkages created for 16 countries. Most of those countries are in Africa. Those are the ones highlighted in green here. We also have a few countries in Europe, Latin America and the Caribbean, and Asia in blue, yellow, and purple, respectively. When you're doing these linkages, it's important to be aware of the time differences when the data were collected. The DHS sample collection, survey collection is probably not going to be during a census year. And that's what we're looking at with the green and purple dots here. The green dots represent census years where we have data in IHGIS. The purple dots are the DHS sample collection periods. And for most cases, most research questions, you're going to want to be looking for contextual data from the census that precedes when the survey data were collected so that you can have an idea of how the context around that person may have influenced what their state is at the point when the survey was done. So just to be aware of that. And that is one of the reasons that we include the census year in the very long name of those linking variables as a reminder that these are not from the same time period as the census or the survey sample. Next slide. This is where I hand it off to Sue. Take it away.
Thanks, Tracy. So at this point, we are going to look at an example research question that you might be interested in exploring, that you can use these linkages from IHGIS and DHS to answer. And so we're exploring the relationship between child stunting and district level food shortage in Uganda. And what we're going to do is we're going to walk through a live demo today to show you how to build data extracts from IHGIS and DHS to get the variables that you need in order to explore this research question. Before we jump into the live demo, we're going to go over what data is available from either collection. So from IPUMS DHS, we have child level records from the Uganda 2011 Demographic and Health Survey sample. And we're going to look for the height for age Z-score as the measure of child stunting. We're also going to look for variables for child and household level controls. And we will also be adding to our data extract the linking variables that you need in order to link the DHS sample clusters to corresponding IHGIS geography. From IHGIS, we have tables from the Uganda Census of Agriculture for 2009. And we are going to add to our data extract counts of agricultural households that experience food shortage. And this is enumerated at the district level, which is the second administrative level. At this point, I'm actually going to leave the slide deck and I'm going to reshare the IPUMS website for each of the collections, DHS and IHGIS. You are welcome to follow along as I walk through the different steps. At the end of the webinar, we're going to share a link to the GitHub repository that we have created for you. It's going to contain a file that has screenshots of all the steps that I'm going to walk through today during the live demo. So in case you miss a step, you'll have that to reference at the end or afterward. That repo will also contain files for a hands-on exercise with guidelines and an R script so that you can explore a hands-on exercise answering this specific research question on your own if you'd like. So at this point, I'm going to stop sharing. And I'm going to reshare. So first, we're going to start with building a data extract from IHGIS. And you can access IHGIS and all of the IPUMS collections by going to ipums.org. That is the landing page where you can navigate to each individual collection's website. You could also enter in the browser ihgis.ipums.org. You'll notice on the left-hand side here, we have links for helpful resources, documentation, supplemental data, and general support. And all of the IPUMS collections have this on their landing page, main landing page. To start building a data extract, we're going to navigate down to this very helpfully labeled section, Start Here, and you're going to click the button Get Data. That should take you to our page for data access. And you'll see that, excuse me, you have the option to apply filters to specific data sets that you want to build a data extract for. So we're going to start doing that by clicking on the data sets button here on the top left. That will open up a new window, and it's organized by types of censuses. So we start off with population censuses at the top. What we're interested in is the Uganda agricultural census for 2009. So I'm going to scroll down to this section here where we have our agriculture censuses. Locate Uganda. That's further down at the bottom here in the list. You'll note as I hover my cursor over to the dataset ID, there's a link that if you click on it, it will pop open a window that describes the dataset level metadata detailing information about the census that the dataset is sourced from. In order to add it to the data cart and to build your data extract, though, you need to click on this plus sign here to the left of the ID. Once you do that, that icon will turn into a check mark. Now you're going to click Submit at the bottom right corner here. And once you do that, you will notice that the data access system has now been filtered to 38 source tables for this specific data set. The table that I'm interested in downloading is going to represent counts for agricultural households that experience food shortage. So we see that the amount of tables is limited to only 20. So I'm going to expand my filter to show all of them. And I'm going to scroll down a bit to the table that contains the ID AAX. And AAX is that table that I'm interested in, agricultural households that experience food shortage. And similarly to before, I'm going to click on that plus icon there to select it. When I scroll up to the top, in the top right corner, you'll notice that we now have one source table added to our data cart. When you click Continue, it will take you to a new page where you are prompted to select tabulation geographies. And tabulation geographies are sets of units for which data are reported, and it determines the amount of rows in your data tables. Since this table from the Uganda agricultural census is enumerated at the district level, which is the G2 level, your only option is when you have so you'll see you have districts as an option and G2 as an option. So when you click on G2, your only option is selecting districts for this table. If you have other tables in your data extract from different censuses, by selecting G2, you might be selecting multiple tables across the different censuses. So now I'm going to click Submit and click Continue again. in the data cart. And at this point, you have an option to include a description for your data extract, which I'm going to enter now. This description will appear on the page that lists your history of extracts, and it's helpful for you to enter a description so that you can remember what you included in your request. Once I click submit though, well, I am already logged in, but when you are creating a data extract for the first time, you actually have to create a general IPUMS account to log in order to build an extract and download it. Up to this point, you are able to view the data and build a data extract from IHGIS, but you can't download the extract until you log in. So what I'm going to do is visit IHGIS again and click the login link. And this is what you would see if I wasn't already logged in. And in order to create a general IPUMS account, you'll see here that there is a link, create a general IPUMS account, hyperlink. And when you click on that, that will take you to the registration page where you fill out your information and a brief description of a research statement. And it doesn't have to be very long. And after filling that information out and checking off the agreements for terms of use and clicking submit, you will have immediate access to create data extracts and download your data for IPUMS collections. So I'm going to navigate back and log in with my information. I'm going to, so as you can see, because I was already logged in and I navigated from the home page, I've now navigated back to the main home page. But to go back to the data access system, you can actually click on select data at the top here, and that'll take you back to where you need to go. And apologies for that little hiccup. I'm actually going to recreate my data extract right now for the Uganda 2009 agricultural census. So I'm just going to walk through that very quickly just to get back to where we need to go. Navigating back to AAX, adding that to our data cart, clicking continue, selecting our tabulation geographies, clicking submit, clicking continue, entering that description, and here we are. So now that the data is available to download, you can see in this column here that you can download your tables right away. When you click on that link to download, it will download a zip file, which contains CSV files for your data tables, as well as metadata CSV files and a text file for the code book as well. And now that we have our IHGIS summarized table for agricultural households experiencing food loss, we are now going to move on to downloading data from IPUMS DHS. And I'm going to log out this time to make sure that I am not logged in to IPUMS DHS. You can navigate to IPUMS DHS by clicking on the Global Health link from the main IPUMS webpage. You can also enter dhs.ipums.org in the window entering IPUMS dhs.ipums.org as a link in the address bar at the top to navigate directly to IPUMS DHS. If you do access IPUMS Global Health through the main landing page for IPUMS, when you click visit site, that will take you to the landing page for all 3 of the global health collections. So navigating back to IPUMS DHS, in order to begin a data extract for IPUMS DHS, scroll down to where you see create an extract and click get data. You will see a window popping up that prompts you to select a unit of analysis. And what we want is children because we are looking for child-specific records for child stunting. So I'm going to click children here. Now, before we proceed, This is where you will need to log in within an account. And this is a separate account from the general IPUMS account that I just detailed earlier for IHGIS. IPUMS DHS uses an account that is administered by the DHS program. So you'll need to register for an account and get approval prior to creating an extract through IPUMS DHS and downloading the data. In order to register for the account, you could click on the link up here at the top right, register. And that will navigate you to a page with some options. And what you would want to click is this link here, apply for access. And when you click apply for access, that takes you to the DHS program page where you fill out a new registration form with your information, as well as selecting the specific countries that you want for from the DHS program for your analysis. Once you fill out this information and you submit the registration form, it's a brief waiting period before you get approval. But once you do get that approval, you will be able to use that login to log into IPUMS DHS to build a data extract and download the data. So I'm going to go ahead and click login here, enter my information that I use, that I have from the DHS program that I received approval for. Click submit. And now I'm going to navigate back to the data access system by clicking select data here at the top. We are still at the unit of analysis that we selected, children. And so now we are going to select our sample, which is going to be the Uganda 2011 sample. After you click select samples, you're going to scroll down in the new page all the way down to where you will see Uganda. This list might be shorter for you depending on what countries you chose when you registered for your DHS account. Locate 2011 and click the checkbox to the left of that year next to Uganda, and then click submit sample selections. Now we are back at the data access system. Under select variables, what we're going to do is choose our child stunting variable. So hover your cursor over the topics drop-down menu, and we are going to select child anthropometric variables. And the two variables that we want are age of child in months at the top of the list here. So similarly to IHGIS, we are going to click this plus sign to the left here to add it. And the child stunting variable is this height for age, z-score, height for age, standard deviations from the median variable. So I'm going to click this plus sign here as well. And note that we have several variables that measure height for age, z-score, but we are using for this analysis the one based on the World Health Organization standard. Scroll back up to the top and you'll notice that the data cart now has our two variables that we selected for our one sample. If we click on View Cart, you'll note actually that there are more than two variables selected. That's because these are pre-selected variables that are relevant for many analyses and are included by default. And one of those pre-selected variables I want to point out is the DHS ID that we had went over earlier in previous slides, and this is the key to link DHS clusters to contextual data. At this point, I'm actually going to add more variables. I'm going to add one more child level variable and then also our linking variable that we need. So under the header data cart, click on add more variables. And I'm actually going to utilize the search function under select variables here. When you click on that, it takes you to a new page with a search bar. And the variable that I want to add is unimproved toilet facility. So I'm going to enter the search term toilet. And for DHS, it's helpful to limit your search to variable name and label, but you don't want to limit it to description. So I'm going to click search. We have 40 results from that search term. And you'll note that the variables that are available in our selected sample, Uganda 2011, that is marked by a large X. And if the variable is not available, that's marked by a dot. And the one that we want is this one in particular, the unimproved toilet facility for the household. So I'm going to click the plus sign there. And now I'm going to look for our linking variables. So under select variables, hover over the drop-down menu topics again and navigate to geography. And then IHGIS geography. Here, we want to select the linking variable for the geographic level that we downloaded contextual data for, which is level 2, specifically for the 2009 agricultural census. So this is the linking variable that we want. And additionally, we would also want the probability variable, and this variable reports the probability that a DHS sample cluster was placed in the correct IHGIS geographic unit. So it's labeled similarly as the linking variable, but ends with the letter P. So I am going to select that one as well. Scrolling back up to the top, we see that we've added those variables to our cart. So if you click View Cart here, now we are ready to create our data extract. So I'm going to click that button. On this page, you'll note that you have an option to change your data format for your data extract download. If you're using IPUMS R, it's helpful to leave it as a DAT format. But we also offer CSV, SPSS, SAS, and Stata formats as well. And similarly to IHGIS, what you do want is to include a description for your extracts here. And click Submit. This won't take too long to process, but once it's finished processing, the column download data will reveal a link for you to download your files. We also recommend downloading the codebook as well for your extracts because it describes the variables associated with the codes in the extract. If you're using IPUMS R, it's helpful to download it as a DDI file, but if you'd like, you could also download a basic text file as well. When you click on basic, it opens a new page with the text for the codebook that you can copy and paste into a local text editor. And now we see that the file is ready to be downloaded, so it didn't take too long at all. All right, so we have our variables from IPUMS DHS and IPUMS IHGIS. The other two files that we are going to download are the shape files or shapefile for IHGIS, and this is the boundary file for where the IHGIS data is summarized, and we will navigate back to the IHGIS homepage to get that. You can click on the icon here to navigate back to IPUMS IHGIS. And so we're not in the data access system anymore. We are back at the homepage for IHGIS. And on the left-hand side here, if you scroll down to supplemental data, click on geography and GIS. And now you can scroll down to the data set that you want to download boundary files for. So I'm going to scroll all the way down to Uganda and look for the Uganda 2009 agricultural census. And I am specifically going to download the shapefile for districts G2 because that's the geographic level in which we downloaded our table or data for. When you click on this link, it should download a zip file directly to your local machine. I won't do that here, but it should be just a direct download, and you can choose where you save the file locally. And now, finally, we are going to navigate over to IPUMS DHS to download crosswalk files. This is optional. Crosswalk files contain complete information about all possible units that each DHS cluster point could have been located in. So if that's the information that you want, we have that available for you to download directly as well. And in order to do that, you can navigate to dhs.ipums.org. This is the main homepage for IPUMS DHS. On the left-hand side here, navigate to Geography and GIS under Supplemental Data. And scroll down to where you see Aggregate Census to DHS Supplemental Level of Geography. And in that description, there is a link user note with the IHGIS team. So when you click on that, that will take you to the page with direct links for the crosswalks that you can download. You can jump directly to that section by clicking on this bullet here. And you could also click on the link for Uganda, and that will further jump you down to the section where you have direct links to those crosswalks. And if you were downloading the crosswalk file for this particular analysis, each file is representative of a direct crosswalk for one DHS sample to one IHGIS tabulation geography. So what we want to look for is DHS 2011 to IHGIS 2009 agriculture level 2. So if I click on this link, this will directly download a CSV file to your local machine. So now that we have all the files that we need in order to answer this or explore an answer to this research question, I am now going to navigate and jump back to our slide deck so we could go over some of the results from our data analysis. Looking at the child stunting variable, we see that of the children measured for height for age Z-score, 33% of them are considered stunted, which means that their height for age Z-score was greater than 2 standard deviations below the WHO standard. If we look at the counts of agricultural households that experienced food shortage from the Uganda 2009 census, we see that the number of districts are roughly uniform in the ones that have between 30 and 100% of their households that experience food shortage. We also notice that there is little spatial patterning in the food shortage as well across those districts. We initially wanted to look at the potential relationship through scatter plot visualization, looking at the relationship between the percent of households in districts experiencing food shortage and the measured height for age Z-score, which we see on the y-axis here. But as you can see from this visual, this is not a very helpful visualization. That's because at this having this multi-level variables in this contextual data, all the children have the same value for the x-axis for the districts experiencing food shortage. So what we ended up doing was exploring this in the form of a bar chart. And the results were a bit interesting, although unexpected. On the x-axis here, it's the same x-axis where we have the percent of households in districts experiencing food shortage, but on the y-axis, we have the percent of children stunted. And as you can see, as the percent of households in a district experiencing food shortage increases above 50%, the percent of children stunted actually decreases. Keep in mind, though, that for this visualization, while we have measured here the percent of children stunted, DHS samples are not designed to be representative for units finer than admin level 1. So calculating this percentage is not advisable for analysis, but it is helpful for data exploration, like in this case. And for our analysis, we performed a logit model analysis, and we wanted to look at the probability of child stunting determined by the percentage of agricultural households that experience food shortage. So we controlled for mother's age, mother's years of education, whether or not the household used an unimproved toilet facility, child's age, and whether or not the household was located in a rural area. And we limited our sample to those children whom the stunting was measured, and also to those children that were more than 23 months old, because they would have been the ones conceived during or before the food shortage reference period. And our results from the logit model were also interesting and unexpected. So an increase of 1% of households in a district that experienced food shortage in 2009 was associated with a 1.23% decrease in the probability of a child being stunted in 2011. We are going to table for now why we think this is. We do have some ideas, but we're going to revisit this during the Q&A portion of this webinar, where we'll invite folks to present any thoughts or hypotheses as to why this can be. And you also have the opportunity to explore this on your own with the hands-on materials in the GitHub repo. Just some additional research ideas that you can explore with these linkages. You can look at how types of crops grown affect children's enrollment in school, prevalence of breastfeeding, and dietary diversity. And these variables in purple are available from IPUMS DHS or the DHS samples. And the types of crops can be pulled from IHGIS, from agricultural censuses. And from the population and housing censuses, you can look at how community level education are related to children's vaccination rates, and how community water supply and waste disposal infrastructure are related to incidences of diarrhea. And for the remainder of the presentation, I'm going to go over some linkage details with you. First, I'm going to go over that crosswalk that we walked through downloading earlier from the IPUMS DHS homepage. So these crosswalks, again, have the full information that complete information that you want of all possible units that each DHS cluster point could have been located in. What that means is that some DHS clusters are associated with multiple census units. So in these cases, the proportions across those units will sum to 1. And each file, as a reminder, is representative of a single crosswalk between one DHS sample and one IHGIS tabulation geography. In computing the placement probability values of the DHS clusters, those are based on if the displacement buffer around those cluster points have crossed 2 or more census areas. For those that haven't crossed over 2 or more census areas, those probability values are 100%, which means that those units have 100% confidence that those cluster points are located in that unit. For those that do cross over, that reduces that probability to less than 100%. And crossing over those displacement buffers, crossing over boundaries, splits the probability of which unit that cluster point likely falls in. And the higher proportion of that buffer in a unit means a greater confidence that that cluster point belongs to that geographic unit. You may want information from that crosswalk we were looking at earlier to combine contextual data across units for cluster points that are near borders, since people are likely to be influenced by the context in all nearby units. As geographic units get smaller, so do our confidence levels. Typically, a majority of cluster points that are 100% confident in their placement are within first or second level administrative units. But as these administrative units get finer, there are more units for the buffers to cross over. So we're less confident about exactly which one they are located in. There are some unit boundaries that the DHS program will not displace points across. And we have discussed so far how we calculate probabilities for points close to borders of fine scale units. But knowing that the DHS won't displace points across boundaries of certain container units, this introduces a subtlety that helps refine our probability calculations by completely disregarding those buffer sections outside a cluster points container unit. And this is something that you might find useful to keep in mind if you're interested in those cluster points that are close to a border of a contextual variable. So that's all we have for you for the presentation portion of this webinar. Here is the link to that GitHub repository that contains the screenshots of all the steps that I walked through during the live demo earlier. It also contains the materials that you would need for a hands-on exercise where you can explore this particular research question on your own, building data extracts from IHGIS and DHS. And so at this point, we'll open it up to Q&A.
Thank you all. With that, it is officially time for us to wrap up our webinar. I want to thank Tracy and Sue again for sharing their knowledge and expertise, and all of you for joining.